Before starting your immunotherapy treatment, there are some important details we'd like to share with you. As you watch the video, please have a pen and paper nearby to write down any questions that you would like to ask our healthcare team. Since your diagnosis and as you commence your treatment, you may experience a range of emotions and find things overwhelming. The process of diagnosis and commencing treatment is full of many unknowns and can be very daunting. These are all normal reactions to a difficult situation, but there are ways to manage these feelings so they do not overwhelm you. We want you to know that we're here to support you. We offer guidance, reassurance, support, and information to help prepare you for your upcoming treatments. Complementary to your personal support network, there are many other support services accessible to you, both at MARTA and outside of the hospital. Our nurses and doctors will continually reassess your condition and offer support as needed. We also encourage you to voice any concerns you may have, from coping with your diagnosis to side effects from treatment. We want to empower you through your healthcare journey with us. Many of us find it difficult to ask for and accept support, even when we need it the most. When facing a diagnosis of cancer and the demands of treatment, having a strong support network can make an enormous difference. Your nursing team may suggest additional supports to assist you during this time. This may include a referral to a social worker who can assist with accessing services like Centrelink, insurance, and superannuation. What is cancer? Your body is made up of trillions of cells. Your healthy cells normally grow and multiply in a controlled way. Once they have performed their designated function, they follow the normal process of cell death. The term cancer describes the many diseases that occur when the body's cells do not replicate in this controlled way. Every day we replicate our cells with new cells. Sometimes there can be a mistake in this process. The immune system ordinarily detects the error and gets rid of these cells before they have a chance to replicate themselves. If for some reason the immune system misses the error, there can be an uncontrolled multiplying of cells. This can cause a tumour forming or abnormal blood cells. When these cells spread into surrounding areas and travel to different parts of the body, they can cause disruption to the normal functioning of healthy cells, tissues, and organs. A malignant tumour is one that can spread via the lymph system or blood vessels. A benign tumour is one that cannot spread. When a malignant tumour uses the lymph nodes or blood vessels to spread to another part of the body, we call it metastatic disease. Why doesn't the immune system always work? Sometimes the natural immune system isn't strong enough to fight off the abnormal cells. Other times, cancer cells can mutate over many years and be unaffected by the immune system's response. The immune system cannot always recognise that the cell is abnormal. The human immune system is a very complex system with many organs responsible for immunity. You may have noticed the terms B and T cells on the diagram. These cells are responsible for finding cells that don't belong in the body, like cancer or an infection. The B and T cells mark these abnormal cells and mount a defense to attack them. There are many different kinds of cancers, which is why there are different kinds of treatment options available, including chemotherapy, immunotherapy, targeted therapy, surgery, and radiation. These treatment options can be used on their own or in a combination. The type of treatment will depend on the type of cancer you have, where it has started in your body, the stage of the cancer, as well as your age and general health. All of these options will be discussed with you and your doctor to find the most effective treatment for you personally. There are many emerging treatments, and you'll no doubt hear of them or see news stories on immunotherapy and targeted therapy. Given how complex the immune system is, these treatments are complex in nature too. Immunotherapy is designed to activate the immune system to fight the cancer cells. Essentially, these medications assist the body to kill off the cancer cells themselves, rather than have a medication that kills the cancer cells. There are medications called checkpoint inhibitors that reflag the cancer cells to the immune system so it can see it again and kill the cells. This is effective because some cancer cells can hide from the immune system by mutating or camouflaging. Therefore, the cancer can grow without any interruption. Immunotherapy treatments place a spotlight on the cancer cells so the body's immune system can then kill the cancer. Immune stimulants are another kind of medication that works in a similar way, reactivating the immune system to attack the cancer cells. We can also include preventative vaccinations against viruses like the human papillomavirus, or HPV, that prevents contracting the virus that can cause cervical cancer. Immunotherapies and targeted therapies are very different types of cancer treatments. Targeted therapies are medications that block a protein, enzyme, or signal that is contributing to the growth of a cancer. Unlike traditional chemotherapy, the targeted therapy medications launch an attack on a specific target. Immunotherapy is different because it activates the immune system to attack the cancer that it couldn't see or kill before. The two main types of targeted therapies are monoclonal antibodies and small molecule inhibitors. Monoclonal antibodies all work in very different ways. Some use antibodies that can stop or slow the blood supply to tumours. This will starve the tumour and stop or slow its ability to keep growing. Others can block specific proteins that assist the tumour to grow or target the specific cells that are on the tumours, killing the tumour that way. Small molecule inhibitors work by blocking enzymes that signal the growth of the tumour. They stop the formation of cells that come in to try and repair damaged tumours. Your healthcare team will be able to explain how your immune or targeted therapies work for your diagnosis. Because treatments are personalised specifically to you and your diagnosis, not everyone is eligible for each treatment. Chemotherapy is still widely used for most types of cancer. In some cases, chemotherapy can also be used with targeted or immune therapies too. To determine the best treatment for you, we'll take a biopsy of the tumour when you're diagnosed. Once the biopsy results are known, your doctor will then prescribe a treatment which we know is proven to be effective for your specific diagnosis. Patients receiving targeted therapies are usually those who require the treatment to eliminate any remaining cancer cells after surgery, to treat advanced cancer not responding to other treatment, to treat cancer that has relapsed after having initial treatment, or as a maintenance therapy to prevent cancer from returning. Targeted therapy is also used less commonly as an initial treatment method for a new cancer diagnosis. Your treatment can be given in several different ways, including intravenously or through a drip, injections, or orally with tablets or capsules. Intravenous or IV immunotherapy or targeted therapy is administered directly into the bloodstream. It can take anywhere from 10 minutes to several hours to be infused. Often you will be given medications prior to your treatment to assist with the management of side effects like nausea. There are multiple ways to receive IV treatment. The best method for you will depend on the type of treatment, how often it will be administered, how long the treatment will last, and your veins. For some people, having blood tests or an IV drip inserted is difficult. The first method is a cannula, typically inserted into the forearm. This is a temporary cannula that is inserted on the day of treatment and then removed before you go home, unless you're admitted to the hospital, in which case it can be left in for longer. The second option is a peripherally inserted central catheter, also known as a PICC line. This device can be left in for months. A PICC line is inserted in radiology with a local anaesthetic. This stays in the inner arm above the elbow until it is no longer required and is always covered by a clear dressing. The PICC line does require a weekly dressing by an oncology nurse. The dressing will need to remain clean and dry, so will need to be covered for bathing and showering. This means you cannot go swimming while the PICC line is in. The removal of a PICC line is a relatively painless procedure and can be done at the end of treatment by your nurse. The third option is a portacath. This is a longer-term access device that can be left in for up to 10 years. This device is an implant, so you can swim and bathe normally. The implant is put in under sedation as a day procedure. When required, it is accessed with a specialised needle by the nursing staff. The needle is then removed once treatment is completed. When not in use, the port will need to be accessed and flushed at least every 6 to 8 weeks. The port is also removed under sedation in the day procedure unit when you no longer require the port. You can have your regular blood tests from both the PICC line and the port instead of from your arm by a cancer care nurse. Community pathology centres cannot access these devices. The PICC line and port can be great options for those who have difficulty with cannulation or have treatment over a long period of time. Please ask your nurse or doctors about the risks and benefits of these different devices. Before each treatment, you will need to get a blood test. This can either be done on the day of or 1 to 2 days prior to treatment. If you are receiving treatment at Mater Cancer Care Centre, our reception team will give you a self-assessment form. Please complete this form and give it to your healthcare provider before treatment. By completing this form, it will help us in detecting and monitoring any side effects and distress levels. This will assist us in treating and managing these concerns before they become serious. The form includes a distress thermometer, which we can then use to make referrals to the cancer care coordinators and allied healthcare team if required. Throughout treatment, you may find that you have side effects or personal circumstances that change, and this may cause some distress for you. It is important to rate your distress levels honestly. This can be a very difficult time in life, and we want to ensure you have the support you require. The nurses will also do a physical assessment, including taking your blood pressure before your treatments and throughout your stay with us. Whenever your healthcare team commence, administer, change or remove your treatment, they will be wearing protective equipment. This will include a long-sleeved gown, a face mask, purple gloves and goggles. They will also wear this outfit when handling any of your bodily fluids. The purpose of this equipment is to protect the nurses from continual exposure to the treatment. Your visitors are more than safe to remain in the room while you receive your treatment. We recommend that young children do not come into the Cancer Care Centre due to the infection risks to other patients and personal safety for the child. When the immune system is overactive, it can irritate and inflame your organs and other areas in the body. The management of these side effects is often quite different to a person receiving traditional chemotherapy. If you're having immunotherapy, treating your inflamed gut is essential in easing diarrhea, rather than using over-the-counter medication. It is very important to highlight to any healthcare provider that you are receiving immunotherapy to ensure you receive treatment promptly and appropriately for your immunotherapy and symptoms. The side effects from immunotherapy can take some weeks to months to completely resolve. Not reporting your symptoms could result in gaps or delays in your treatment. You may experience flu-like symptoms, including fever, chills, or sweats. You can also experience other symptoms like skin rashes or irritations, nausea and vomiting, diarrhea or gastritis, fatigue, headaches or blurred vision, wheezing and shortness of breath, infections, weakness, yellowing of the skin or eyes, and body aches and other symptoms. If you experience any of these symptoms, please let your healthcare team know immediately. We may need to treat these side effects with medications to calm the inflammation. Medications commonly used are antihistamines and steroids. Fatigue is a very common side effect of all cancer treatments. Fatigue can be due to the cancer itself, the treatment, any infections, anxiety, or just the extra demands on your body to get to appointments. Energy conservation is really important during treatment. It is often hard for all of us to ask for help, but now is the time to delegate to your family and loved ones, or even community services. Try to save your energy and only do the things that need to be done. Exercise can be beneficial both physically and psychologically, and can in fact improve your energy levels. The exercise should be light, like a leisurely walk. If you normally do high-intensity exercise, we encourage you to discuss your exercise regime with your doctor first, as you may need to alter your exercise routine. Short naps can be helpful, but be sure not to nap any longer than an hour at a time, or too close to your bedtime. You need to make sure you're still getting quality sleep overnight to allow for a better recovery. If you are planning to continue working while receiving treatment, we encourage you to think about reducing your hours, accessing sick leave, or utilising income protection. If you'd like assistance with these concerns, please approach your nurse who will refer you to a social worker. It is common for your appetite to change after your cancer diagnosis and during treatment. You may experience changes to your taste, nausea, or not feel hungry. Immunotherapy can potentially inflame the lining of your stomach or bowels. This may cause stomach upset, diarrhea, or abdominal cramping. If your treatment has the potential to cause nausea, you will be given some anti-nausea medications prior to treatment. We'll also give you anti-nausea medications in tablet form to take after treatment at home if needed. If you still feel nauseous, please let us know. You should not feel so nauseous that you cannot keep any food down. If you are unable to eat or drink, please go to your local emergency department for treatment of your nausea and vomiting. Eating smaller, frequent meals instead of 3 large meals a day may be more manageable for you with a changed appetite. Having smaller, frequent meals or snacks can reduce the feeling of nausea and ensure that you still have enough nutritional intake. Mild flavours and cold foods are often better tolerated if you're feeling nauseous. Please continue to take your anti-nausea medications as prescribed. If you are losing weight or having difficulty with nausea, a referral to a dietitian can be made to assist with dietary options and supplements. The lining of the mouth can become inflamed during treatment and cause general irritation or mouth ulcers. Please let us know if you notice any changes in your mouth or throat, like redness, ulcers, or if you are finding it difficult to swallow. The use of mouthwashes can help to ensure all food particles have been removed after eating, reducing the risk of ulcers. You can use a half a teaspoon of bicarb soda or salt in a glass of water. You can also use Biotene, a non-alcohol based mouthwash that has a minty taste. Please avoid regular mouthwashes as these can often further irritate the inside of your mouth. Please use a soft toothbrush to reduce the risk of irritating the gums. Avoid acidic or spicy foods. If you require any dental care during treatment, please discuss this with your doctor prior to visiting the dentist, as this may impact your cancer treatment. Depending on your treatment, your immune system may be overactivated, which may result in you feeling a fever or high temperature. This could be a side effect of treatment or from an infection. Please take your temperature once a day and any other time you're feeling unwell. Keep an eye out for a temperature of 38 degrees Celsius or above, chills or sweats, persistent or severe vomiting, unusual bleeding, a sudden increase in pain, redness, or swelling around an IV device. If you have a temperature, please go to your local emergency department for assessment and treatment. If you are very unwell, or if you don't have a loved one to bring you to hospital, call 000 immediately for an ambulance. Do not drive yourself to hospital if you're significantly unwell. Please bring your medical alert card with you. Be sure to keep this in your wallet at all times. The card will inform the emergency department staff of what treatment you're receiving, so they can make sure to provide the best care for you. If you would like any advice regarding your treatment or management of side effects, please call your local Mater Cancer Care Centre. If you're calling after hours, please call the main hospital switchboard and they'll be able to connect you to the on-call team. If your private doctor has provided you with an after-hours contact, please call that number for advice. To keep your treatment plan on track, it's important to stay as healthy as possible. The common cold or flu can be hard to avoid, but following these simple tips will help you to avoid infection during treatment. This is another reminder to check your temperature at least daily during treatment. You can use an oral thermometer, which can be purchased from any pharmacy. If you are feeling hotter than normal, shivering, or not feeling 100%, recheck your temperature. If you notice that your temperature is gradually going up, or if your temperature is over 38 degrees Celsius, go to your local emergency department as soon as possible to treat a potential infection or reaction. Please note, taking paracetamol may mask a potential temperature, so please check your temperature before taking any painkillers. Be mindful of food preparation during treatment. For example, eating well-cooked foods, safely storing foods by freezing leftovers, and eating fresh foods when possible are all great steps towards maintaining a healthy and safe diet. Visitors are important and encouraged. However, if they are unwell, please ask them to stay at home and visit you when they're well again. Avoid heavily crowded areas when undergoing treatment, like the supermarket during busy periods, school pickups, or large events. Wash your hands regularly, especially before and after handling food and using the bathroom. Encourage friends and family to do the same. Treatment can cause irritation to your gut. When the bowels are inflamed, you can experience tummy cramping with or without diarrhea. This also means that your body will not be absorbing the nutrients in your food that it needs to. If you have diarrhea, please contact your care team immediately, especially before taking any medication to stop or slow the diarrhea. If the diarrhea is caused by your treatment, then it will need to be managed appropriately. Please don't assume that the diarrhea is related to food poisoning, as the treatment for food poisoning is vastly different to the treatment we may provide if the diarrhea is related to your cancer treatment. Start drinking more water and avoid foods that could potentially cause further irritation in the gut. Your cancer treatment may cause some changes to your skin, including rashes, swelling, itchy, dry or flaky skin. The rash may look similar to acne or pimples and can be anywhere on the body. You may require some medicated creams or tablets to manage the rash. While you can't prevent a skin reaction caused by the treatment, you can maintain healthy, moisturized skin to lessen the impact of these side effects. Using unperfumed and neutral products like Cetaphil or Dermaveen can help. Moisturize your skin daily and after a shower or bath. Protecting your skin from the sun by using sunscreen and wearing protective clothing is highly recommended. Try to avoid products with alcohol, acetone, perfumes or dyes. These ingredients may be found in products like perfume or nail polish remover. Please report any changes to your skin to your healthcare team. Check the skin in the bathroom mirror at home regularly to be on the lookout for any changes. Shortness of breath or feeling wheezy is a less common side effect, but it can become serious if untreated. The treatment can cause an inflammation in your airways, which can make it feel like you can't catch your breath easily. It is important to report a new or worsening cough. If you're at home and you have a new shortness of breath, or if you are having difficulty walking and talking due to breathlessness, please call 000 immediately. This is a medical emergency, and you should present to the emergency department for immediate assessment and treatment. When you arrive at the emergency department, let the doctors and nurses know that you have received immunotherapy and present your medical alert card. Fingernail and toenail changes are less common, but can still occur whilst on immunotherapy. These changes may look like discoloration of the nail, thin or brittle nails, pain in the nail bed, or in some circumstances, you can get an infection under the nail. If you experience any of these side effects, try regularly moisturizing your hands, regularly trim and keep nails clean, and use non-acetone nail products, and avoid professional manicures as this is an infection risk. As always, please report any changes to your healthcare team. Immunotherapy can cause some irritation in the eyes and inflammation in the tear ducts. Your eyes may feel either dry or irritated. If this is the case, lubricating eye drops can provide some relief. Please let your healthcare team know if you're experiencing tender eyes. They can write you a script for medicated eye drops. Avoiding eye makeup can help to reduce inflammation around the eyes. If you are experiencing any headaches or vision changes, please speak to your healthcare team for advice. Immunotherapies can cause inflammation in the joints. You may feel pain in your joints and they could feel warmer than usual. This may need to be treated with steroid medications and pain relief. Immunotherapies can cause a discoloration to your urine too. This is a less common side effect but may be caused by inflammation to the liver, which leaks a substance called bilirubin. The urine can become darker or even have some blood. Please notify your healthcare team if you experience joint pain or changes to the colour of your urine. Your treatment may impact on your desire or ability to have sex. This may be because you feel tired, unwell, less confident, or there may be a physical concern preventing you from being able to have sex. We encourage you to discuss your concerns around sex with your healthcare team. Sex may not always be possible, but closeness and sharing can still be a part of your relationships. For women, it is recommended that during your treatment and for the initial months after, that you do not fall pregnant. For men, it is recommended that they do not father any children. Your treatments could cause harm to an unborn child. There is currently limited information on this. If you do fall pregnant or father a child during this time, please discuss this with your doctor immediately. Please discuss pregnancy avoidance methods with your healthcare team. If you are wanting to have children in the future, Please talk to your doctor about your fertility and future options too. Above all, keep the lines of communication open, as there may be ways that we can help you. We often get asked to answer some common questions or bust myths surrounding immunotherapy. Can you catch cancer? No. Is cancer always terminal? No, many cancers are very treatable. Will I be vomiting all the time? No, this is not normal. But if you are experiencing nausea and vomiting at home, please contact your healthcare team for advice and treatment. Will I lose my hair? No. Immunotherapy is not known to cause hair loss like some traditional chemotherapies. In rare circumstances, there may be some minor hair thinning. Can I be around pregnant ladies, newborns, or children? Yes, as long as they are healthy and well. This is to avoid you picking up any coughs or colds. You have been given a lot of information in this session, but the main take-home messages we want you to remember are that we are here to support you. Don't be afraid to ask for and accept help from friends and family. Don't hesitate to ask us questions about your treatment or side effects. Check your temperature regularly. Go to the emergency department if your temperature is above 38 degrees Celsius or you are unwell and concerned. Please ensure you know who to contact if you have any questions or concerns. If you have any other questions, please speak to a member of your healthcare team for clarification.